everyone. So today we are dealing with hypertension and what all the drugs are being used in hypertension. So in this video we are going to understand it. So let's understand it. So as you know that globally over 1.2 billion people are affected with hypertension in the age group of 30 to 79 of your age, and 46% of the people, they don't even know about they had hypertension, right? So this is a widespread problem and let's understand in this video. So what is hypertension? Hypertension means high blood pressure. It's the blood pressure means the force that is applied by the blood against the arterial wall. The force applied by the blood against the arterial wall, if that pressure is high, it causes the damage in that artery wall. And when there is a damage in the artery wall for consistently for a longer period of time, it causes further damage to the different organs. So this is the hypertension. Now to understand the different types of hypertension. Okay, in the different types of hypertension, we have primary hypertension, we have secondary hypertension. Primary hypertension is when there is no underlying causes there. There are something like lifestyle changes are you are having the sedentary lifestyle. Talking about the types of hypertension, we have primary hypertension and we have secondary hypertension. The primary hypertension is when there is no any underlying disease condition is there. Because of your sedentary lifestyle, your more alcohol intake, your more salt intake, because of that there is primary hypertension is there. So if you change your lifestyle, if you do lifestyle modification, this can be sorted out. Now the next concern is the secondary hypertension. Secondary hypertension is when there is underlying causes there. Like if you have some disease condition, like the patient is having CAD, coronary artery disease, or patient is having any kidney disease, any there is any adrenal gland disease, right? So whenever the patient is having pathology, this type of disease condition, then there is secondary hypertension. Now, okay, about the types of hypertension. First is primary hypertension and secondary hypertension. Primary hypertension is whenever there is no underlying disease conditions are there, like patient is having sedentary lifestyle, excess sodium intake, like patient is having more alcohol intake, and patient eating too spicy food. So this is the cause of primary hypertension. If you change your lifestyle, if you do some lifestyle modification, then primary hypertension is get sorted out. Then we have secondary hypertension. Secondary hypertension is whenever there is any underlying causes there, like any underlying disease is there, whether the patient is having already coronary artery disease or any kidney disorders or adrenal gland disorders, some pathology, some disease condition is there that cause the secondary hypertension. There are other hypertensions as well, like white coat hypertension. When you see any hospital staff, your BP is shooted up, like your patient BP is normal at home, but during a hospital setting, the patient BP is high. Now the masked hypertension is just reverse of that, the patient BP is abnormal, is high at home, but in hospital setting the BP is normal. Now next one is the sustained hypertension. BP is high in both the setting, in home as well as in the hospital setting. Next is the nocturnal hypertension, when the BP is normal for the whole day, but during night or during sleep hours the patient is having high blood pressure. So these are about the different types of hypertension. Let's understand the drugs that are being used in controlling hypertension. First is the alpha blocker. Then we have ACE inhibitors. Then we have ARBs, angiotensin receptor blockers, right? Then we have beta blockers. C, we have calcium channel blockers. Then the D has diuretics. In the alpha blockers, we can learn the alpha blockers by using the mnemonics josine, by using the suffix josine, that is prazosine, doxajosine or prazosine, right? And we can learn the mnemonics ACE inhibitors by using the suffix pril, like we are having captopril or enalapril. Okay, then we learn the ARBs by the mnemonics sartan. By the suffix we will use sartan, that is losartan, telmisartan, or we can say olmesartan. Okay, then the beta blockers by using the mnemonics OL, means labetalol. Most of the time we use to control the BP in wards or in emergency, labetalol, or we use the atenolol, right? Then we have the calcium channel blockers. Calcium channel blocker, the most important, it is the amlodipine, by suffix is dipine. This is amlodipine, or we have the nifedipine. Then in the diuretics we have Lasix, or we have the spironolactone, right? So these are the drugs we can learn by using the 3 times A, then B, C, D. Okay, we have A for alpha blockers, next A for ACE inhibitors, third A for ARBs. Then we have the beta blockers, C for the calcium channel blockers, and D for the diuretics. So these are the drugs that are being used in hypertension. So try to learn it and save this video for later.